All right. My guest today is Adil Shamji, the MPP for Don Valley East, twice elected for the Ontario Liberal Party, serves as the critic for health, housing, and indigenous affairs. Adil is also an emergency and family physician, served in rural and remote communities in the north, lives with his wife Salma in Leaside, and we also share a birthday.
Well, it must be why we're such great friends, right?
Adil, welcome to the InCamera podcast.
Really excited to be here. This is going to be really fun today.
Really appreciated you coming here to Mississauga to talk about, Ontario politics, municipal politics. But I want to start with you because, you've clearly established yourself in the medical field. You served in some really interesting and remote places, and that is obviously your passion. I kind of want to understand what got you there first. What got you here to become a politician, right? And, leave sort of the medical field.
Well, number one, thanks for having me on the
left.
show.
I know you haven't left completely, but yeah.
Fair enough. Yeah, no, and I appreciate you clarifying that. I'm still proud to be in clinical practice, but thanks for inviting me to be here and to meet you in Mississauga. This feels a little bit like a homecoming because I spent most of my time growing up on the border between Brampton and Mississauga. I have spent a lot of time very close to these council offices and have always loved my time here. So it's great to be back. My family is Indian. We took the scenic route to Canada. My parents grew up in East Africa, spent some time in the UK, eventually came to Canada, and, had this very typical experience. My father worked really hard to get an education, struggled finding work. We ended up I was born in Vancouver. We ended up in Toronto, started out living in the basement of a family member, rented an apartment, eventually bought a home in Brampton. And then we're able to achieve this dream that all of us in Canada have, where each generation can do better than the next. Mm-hmm. My parents were able to make sure I got a good education in university, to go to medical school. And now I have this crazy, incredible honor and privilege of serving in elected office as a member of provincial parliament. And, one thing that's always been very important for my family and for me is to pay it forward and to give back. It's always been very important to make an impact and to help. There are many people that helped me and my family to get to where we are, and it's important to leave our community better than we got it, and even better for future generations. So for me, I've always wanted to help, always wanted to have a huge impact, and I've always really liked science, which eventually drew me to medical school. And even as I finished my medical training, we learned so much in medical school, but I went to U of T. When you practice in the city, you really only use a fraction of the skills and knowledge that you gained. And as I looked around, I realized how much more help was needed in rural communities, remote communities, First Nations, and indigenous communities. And so I just started going to further and further places that were more desperate for some help. And as I did that, kind of discovered that there were problems that my patients were facing that were really a consequence of government and society not working for them. I can treat someone in an emergency department for their frostbite. I know the bandages to place and the way to treat the wounds and all of that kind of thing. But what is the point of going through all of that if I'm just going to discharge them to sleep on the pavement on a cold winter night to get frostbite again anyways? And it was this frustration coupled with my desire to help and scale my impact that made me think, if I want to fight to fix the biggest problems that my patients are facing, that our province is facing, I probably have to take that fight out of the emergency department and bring it to Queen's Park, which is what has animated me and made me want to work so hard to improve our community.
Thank you for that. I mean, it's difficult to get good people in politics, especially professionals, people who have the opportunity to make a lot more in the private sector or for whatever it is they're doing. But seeing the bigger picture and having the opportunity or the desire to try and fix that is something we need more of, right? And so thank you for taking that step. I want you to sort of talk a little bit more about those northern communities, because I know I think you were in the territories as well as northern Ontario. Let's give people a little bit of a taste of what life is like up there, because when we're talking about really rural, you're talking about fly-in communities, right?
Absolutely. I mean, some of the, I've worked in Northern Ontario along the James Bay coast. I've worked in the Northwest Territories, even above the Arctic Circle, and endured, 24 hours of sunlight in the summer and 24 hours of of nighttime in the winter. A few reflections. I was once very moved by something that Chris Hadfield said. He was asked, does it ever get lonely in space? And his answer to that, and obviously I'm paraphrasing, is you can be lonely anywhere, even in the biggest city on the planet. It depends on who you're with. And my experience has always been that being in these communities is incredibly exhilarating. There is usually so much to do. There are such great people. And they're also so grateful that there are other people who are coming into those communities to try and make a difference. Many of these rural and remote communities have profound struggles with a range of issues, including and specifically around healthcare. It's such a privilege to be able to go into these communities to help keep their ERs open, to deliver the primary care that they need and deserve, and to work on the social and community problems that they face. I've always found it incredibly rewarding, and I have to admit, it's always been just so much fun as well. Almost every single community that I've been in has a vibrant social life, so much to do, adventurous activities to pursue. And I'd never gone curling until I started traveling in these rural communities, cross-country skiing in the middle of the night, just really a wonderful time. And so it's been some of the hardest work I've ever done, but most assuredly some of the most rewarding as well.
So seeing all those challenges and sort of rural and remote areas, especially when it comes to healthcare delivery, what do you see on the other side? Where we are right now, we're in Mississauga, we're downtown. It's one of the most densely populated areas. What are some of the healthcare challenges that you've seen in urban areas like this?
It's really interesting because the kind of healthcare challenges that I've noticed in rural and remote parts of our country are very similar to the ones that we face in urban settings like Mississauga. They're just amplified over there. But here in Mississauga, in Brampton, I think some of the healthcare challenges that I'm hearing about, have observed, learned from my colleagues, definitely a massive challenge in access to primary care, in access to diagnostic imaging and wait times, diagnostic imaging, procedures. There are issues with even being able to get access to hospitals. In just across the border in Brampton, there's only one hospital. And hopefully that will change soon. But, if you live in the south of Brampton and need to get to the north of Brampton in the middle of a heart attack, that has the potential to really impact, your clinical outcome. So I see a lot of issues related to accessibility to healthcare, timing of healthcare. And then I find that people are being asked to pay more to get access to things that, as taxpayers, they should be getting already covered. We see this phenomenon now of people who are struggling to find a family doctor, feeling as though they have no choice but to turn to nurse practitioners, which is great. I love nurse practitioners. My sister's a nurse, and they're amazing. But because of these quirks in the Canada Health Act, many patients are being forced to pay for services that would otherwise be covered if they were seeing a family doctor. So as we see a growing privatization in our healthcare system as well, what I'm learning is that healthcare access has the risk of turning into the haves and have-nots. If you've got that extra disposable income, you can get in and see a nurse practitioner, or find ways to go south to Buffalo or something like that to get the care that you deserve to receive right here in Mississauga.
I guess let's get down to what the challenge is and who's responsible. I mean, Premier and the Ontario government is primarily responsible for the delivery of healthcare. What have they been doing or doing wrong over the last 7 years that have led us to sort of this inflection point, this crisis?
In the last 2 years, we've seen the worst healthcare system performance in this province's history. That is manifest in number of people who don't have a family doctor. We've got 2.5 million people, as of 2 years ago, that didn't have a family doctor. And many reputable sources are actually projecting that will be closer to 4.4 million by 2026. So we've got massive issues with people not having a family doctor. We've seen wait times go up. Hallway medicine is through the roof. On any given night, roughly 2,000 people are receiving care in the hallways of our hospitals. And there's a massive health human resource shortage. Not enough family doctors, not enough nurses, not enough PSWs, and not enough other allied healthcare workers who are fully empowered to deliver all the care that they can to the scope of their ability. In the wake of that, we're seeing these massive disparities in access to healthcare. And this has largely come about because of legislation such as Bill 124 that quite literally drove many of our healthcare workers and publicly funded, even teachers for that matter, out of our healthcare system. We are seeing, rampant underfunding of our hospitals. We are seeing this phenomenon where across the province, hospitals are now declaring deficits and seeking out private loans in order to be able to balance their books and being forced to make really difficult decisions about whether they're going to retain staff, hire more people, have to cancel projects to expand new wings so that they can increase the number of beds that they have. So, we've been seeing a lot of underfunding, profoundly misguided legislation such as Bill 124, and a government that seems to prioritize things like scandalous endeavors like the Skills Development Fund rather than investing in the universal publicly funded healthcare system that we deserve. And I'll sort of end by reflecting on the fact that we now are seeing a movement within our healthcare system to try and bring procedures, clinics, tests out of hospitals, which is, in the right setting can actually make sense. Mm-hmm. But largely this government is doing it in a way so that they can move into clinics and operations that are funded by investors and private donors. And the reason that is proving to be so dangerous is time and time again in our healthcare system, we've seen that when some of those private interests become involved, when we see shareholder interests take priority over patient interests, we've repeatedly seen lower health outcomes and more expensive, less valuable care. And this then becomes an issue of spending a lot of money to not get the results that Ontario taxpayers and patients deserve.
My wife is also an emergency nurse, and
props to her.
Survived the COVID pandemic and Bill 124, but she tells me all the time how many people wanted to leave or did leave because they didn't feel they would be getting, pots and pans clamored for them while they were coming home, but also their government was telling them they didn't deserve any increase in pay, right? And so that was really frustrating. I've spent a lot of my career in sort of higher education. Is there a correlation between, how much they're supporting or not supporting higher education with training nurses and doctors and PSWs?
We have nowhere near enough medical school and residency positions than we need. In the last election, the Ontario Liberal Party was really clear that we needed to build at least 2 more medical schools and massively expand the number of residency positions, if we want to address the crisis that we face in primary care. That needs to happen, and this government is not moving quickly enough to do that. We also have this really distinct phenomenon where we have an immigration system federally that prioritizes and celebrates people, doctors and nurses, that have phenomenal medical education and training from abroad. But here in Ontario, we don't do anywhere close to a good enough job of recognizing those credentials and allowing them to practice. In my riding alone, I know that there are study groups of hundreds of internationally trained doctors. And of course, they need to go through the process of credentialing.
Yep.
Yeah, absolutely. But, it needs to be efficient. It needs to be thoughtful. And as it stands right now, there are just so many barriers. It makes it almost impossible for us to address our crisis in a timely manner.
And it's such a strange thing because we say we want these people, right?
Yeah.
I know your wife is a
She's
dentist.
A dentist, yeah.
My father is also a dentist. Yeah. And I can't believe he did this. But in the 70s, he immigrated here with a degree, was a practicing dentist back home. Mm-hmm. And, the federal government said, come here, we'll recognize your credential, we'll give you all these points. And he shows up, and then they say, actually, now that you're in Ontario, you have to start over.
Yeah.
Right? Went back to U of T and basically started from year 1 through dentistry school, which was just wild to me that he would be willing to do that, but that so many immigrants are willing to do that.
Absolutely. I can't blame so many of those immigrants for feeling offended by that policy. And there's another reason for many of them to feel offended literally as we speak right now, Alvin, because you're likely aware that some pretty discriminatory policy has been implemented by the provincial government right now related to international medical graduates that want to apply for residency positions through the match service. And, there's this new policy that's been implemented that they can only be considered in the first round match if they attended a high school in Ontario for a minimum of 2 years. And, this has been widely spoken against by almost every medical institution, regulatory body out there. Canadian Medical Association, Ontario Medical Association, Association of Faculties of Medicine of Canada, have all highlighted the fact that placing these barriers and essentially discriminating against, well-trained immigrant physicians, putting them at the back of the line, especially these are oftentimes the ones who are most likely to go into family medicine, will only serve to increase the disparity in access to primary care and healthcare. And quite frankly, for many of our community members here in Brampton and Mississauga, is going to make it a lot more difficult for them to achieve their dreams and our dreams of having seamless access to primary care.
Yeah. I mean, you talk about Brampton and Mississauga, we're this Peel region. We're actually 1.6 million, 1.7 million people. We're the third largest municipality in Canada, right? And you're talking about one hospital in Brampton, two hospitals in Mississauga. And the thing that I've been concerned about and that I've talked about municipally is the downloading expectation of funding the construction of these new hospitals. We know we have a growing population. We are going to continue to grow in size and in need, because with an aging population, the need is going to get even greater. But the provincial government has said, okay, we'll give you some money for a hospital, that we understand that that's our responsibility, but you need to kick something in. Mm-hmm. You need to kick in 5%. 5% is a lot of money, right? We've committed $300 million on the property tax base here in Mississauga. Brampton's done, I think, $165 million on the property tax base in Brampton to support the construction of a hospital that should be completely funded by the provincial government, right? And the provincial government's constantly downloaded over the years, over different governments, responsibilities onto municipalities. And they love saying that there's only one taxpayer, yet they collect most of the money.
Absolutely.
60% of all public infrastructure is municipal infrastructure, yet municipalities only collect 10% of every tax dollar. And so we're being stretched more and more to do things that we shouldn't be, or as defined, aren't responsible for. I'm not responsible for delivering healthcare, yet now I have to raise everyone's property tax to pay for building a new hospital that we desperately need.
You raise a really important point, and I think, I've been really clear, Ontario Liberals have been very clear, that municipalities in Ontario, they need a new deal. What we've seen, especially in the last 7 years under the current government, is, an increased downloading of what should very clearly be provincial services onto municipal budgets and into municipal hands. I mean, as we face rampant homelessness because of a provincial government that is unable to take leadership on building homes and making them affordable, we're seeing, growing encampments. We're seeing people struggling to put food on the table. We're seeing people requiring increased access to social services and mental health and addiction services. And while the most direct form of service delivery happens at the municipal level, for things like mental health and addictions, social services, they very clearly fall within the purview of the provincial government to, at minimum, fund, and in many cases, to play a significant role in the delivery, such as in the case of hospitals. And so I think it underscores the importance of, elevating and celebrating the work that municipalities do and amazing counselors such as yourself, but also making sure that in order for you to do that incredible operational service delivery, you are well-resourced and funded in order to do that. And what we have seen time after time after time is that this provincial government is not willing to do that. We saw the Ontario big city mayors come out and say, I believe their campaign was Stop the Crisis as it related to homelessness, addictions, mental health. And a big part of that was, give us the funding that will allow us to solve the problems, that typically fall within, that we're being asked to solve, which typically fall within the provincial mandate. It's a fair ask.
Yeah. I've sat on OBCM when I was acting mayor for a little while, for a couple of months. And one of the biggest challenges is that the province likes to make municipalities jump through hoops, right? Apply for this funding, apply for this grant, apply for this, as opposed to just giving base funding that then can be served and planned for over multiple years. And most people don't realize we do a ton of social services. We do most of the social services that people assume are funded by the province. They give us some money to do it, but it's capped, right? And if the need goes up, we can't just serve more people, right? We have to then borrow money from somewhere else in the municipality or try to apply for these grants to get the province to give us more money. And half the time they say no. Half the time it doesn't come to the end of the next fiscal year, right? So you're just sort of stuck between a rock and a hard place of, we have this mandate to help people. We don't have the resources to do it. And if we're going to have to put it on everybody else. And so this has been a huge challenge for us. The other half of the equation has been really around housing as well, right? I mean, I don't think enough policymakers sort of see the picture holistically, that people need housing for good health outcomes. People need
Absolutely.
A job. People need purpose. People need mental health care. All of this connects together. And it seems like the province has woken up to the idea that there is a housing crisis. They talk about it quite a bit. But I don't feel, at least from the municipal level, that the implementation has been effective. They like to chastise municipalities for not building enough housing. We don't directly build housing ourselves. We approve housing. And yet they base their funding on how many units get built as opposed to how many units get approved, right? And so they continue to find different ways to blame municipalities for not building more housing. Yet in Mississauga, I would argue, based on what we've changed, we're one of the easiest places now to build. We've cut our development charges in half. We've incentivized purpose-built rental. 3-bedroom units don't have to pay property taxes for 30 years. We're doing all the things that all the advocates, including myself, have been talking about. You and I sat on the housing panel for the party to make recommendations to say, this is what we need to do, and we've been doing it here. Yet building is still not happening, not just because of regulations, but also because of where the market is right now. So where are you seeing this government sort of fall down when it comes to housing?
I want to respond to something that you said. You mentioned that this government has finally woken up to the crisis in housing. I would push back against that. I think they're just mumbling in their sleep about it. The reality is that there is a massive problem. We've got rampant homelessness, encampments that are creeping up across the province. We have people who don't have the hope of ever purchasing a home. We've got rent skyrocketing out of control. We've got dysfunction at the landlord and tenant boards, so that neither landlords nor tenants are able to get justice. And there are circumstances in which...
It's bad for both sides,
It's terrible for both sides. And against that backdrop, we've got municipalities that are working really hard to solve that problem, like this one over here, and led by people like yourself. But we have a provincial government that is very keen to point fingers at other people, to engage in performative actions, to look as though they are responding to it, but actually doesn't behave as though they have a clue. Over the last 7 years, we've seen over 10 pieces of housing legislation introduced by this government, usually with each one of those bills reversing something that was in the last one. When you can't be building and moving forward in a progressive and sensible and predictable way, it makes it impossible for municipalities to know how to plan, makes it impossible for builders and developers to be able to get into, be able to work towards developing the housing that we need. And home buyers and renters simply don't have the confidence in the market to be willing to take the important steps and spend the money. And all this government can do, is write letters to the Bank of Canada begging them to lower interest rates. And we've had 9 interest rate drops in the last year. Every province and territory in Canada faces the exact same interest rate. And yet, quarter after quarter, the CMHC comes out and tells us that Ontario is the sick patient, the laggard in our confederation. And it's because there's a lack of foresight, a lack of planning, a lack of predictability, and a government that isn't willing to take progressive steps. You mentioned some of the amazing things that you've been pushing for, that you've been doing here in Mississauga. I've been doing a lot of work around on this file as well. Been pushing to make fourplexes, legal as of right province-wide.
I don't know what his opposition to that is, because he's okay with 3plexes, but 4 seems to be one unit.
There's just something magical that happens when you go from 3 to 4, right? And I have to be clear. There is no single solution that will, in one fell swoop, solve the housing crisis. It's going to take a whole bunch of things. Fourplexes is one of many solutions. The Housing Affordability Task Force proposed many of those recommendations.
Which they didn't follow.
Exactly. And
and their task force.
It's their task force, exactly. And then, going back to the earlier points about municipalities being asked to do too much without adequate resources, development charges are, in many municipalities are a major part of the cost of a home. And in many cases, municipalities feel as though they have no choice to do that because they need help with infrastructure. Well, it is the provincial government's responsibility to help with that. And so a big thing that I've been pushing along with the Ontario Liberal Party has been to say, look, let's get rid of those development charges. Now, we have to make municipalities whole at the same time. And that's a great way for the provincial government to step up, to bring the cost of housing down, and to support municipalities in the way that they deserve. And, the final thing, well, not the final thing, but, another really important thing that we need to highlight is we could very easily and rapidly, dramatically reduce the cost of homes if we just remove the HST off of new homes for home buyers. And, I would go so far as to say it's not good enough to take it off of first-time home buyers moving into new primary residences. Let's take it off on all those homes. On all buyers for primary residences. This could readily, in one fell swoop, reduce the cost of a home by $80,000. That's a big difference.
That's huge. I mean, I'm always curious as to try to play out, like, who is the premier listening to? Who are these ministers following advice from? Because it's not like they're not also close with the developers who are telling them these things too. So why are they not taking action on this? Who are they serving? Or are they just sitting on their hands hoping it'll go away?
There is a huge coalition of individuals on the profit side, on the not-for-profit side, that want to see so many of these things implemented. I think the challenge that we have is, for all that this conservative government says about being fiscally responsible, they're not. They are posting record deficits, something like $15 billion deficit this year. That has gone towards funding things like $2.5 billion and, for the Skills Development Fund, which is just rewarding donors, has gone like $3.2 billion for the redevelopment of Ontario Place and the destruction of the Ontario Science Centre, $1.9 billion to move alcohol into convenience stores 1 year early, $3 billion to deliver $200 checks before an election, which we are in an affordability crisis. But $200, is not enough to pay your rent, maybe get you groceries for a week. It doesn't provide the long-term relief that investing that $3 billion could, if it went towards, for example, reducing the cost of a home and helping someone get into a home or an apartment that is theirs to own forever.
Yeah.
So this government has the wrong priorities, makes terrible choices, and we're the ones that suffer as a result of that.
One of the stories my wife tells me is about the frequent flyers who come into the emergency room.
Yeah.
And they call them frequent flyers because they know them, they're aware of who they are and why they're coming in. And based on where she used to work at St. Joseph's Hospital in Toronto, they would see these people who came in not because they had a medical emergency, but because they didn't have housing, they didn't have shelter, and they didn't have food, right? And then so we're using a $1,000 a day bed to solve a problem that it's not built for, right? Which puts pressure on the healthcare system and, exposes the gap that we have on the housing side. Maybe it's just not a way that we've proposed it to them before to sort of say, invest in this and it'll save you in that, right? This is also why I've been a huge proponent of a universal basic income, because if we raise the floor for people, if we help them with what we've learned in school, which is Maslow's hierarchy of needs,
absolutely,
then people can then build upon that, right? So it's not just about giving people a handout, $200. It's about creating a system that will support them and let them thrive on their own.
I couldn't agree with you more. I've always advocated that all policy is health policy, right? It's, if you get housing right, you improve people's health outcomes. Your wife is absolutely right. It is so heartbreaking, working in an emergency department and having people who are coming in for no reason other than they need a little bit of compassion, somewhere warm to stay, and a sandwich, right? It drives up our wait times. It increases the cost of healthcare delivery as well. And it's not dignified for them. Instead, if we could, be working towards housing in all of its forms, right? Apartments and condos, rental, home with the garden, but also supportive care with wraparound services, and in some cases helping people prepare their foods, deliver their foods. We can deliver the dignity as well as the cost savings that all of us are looking for. And for me, as I think about myself as a politician and a policymaker, the best policies are the ones where you can achieve what is right and dignified and financially efficient. And the truth is, there are so many of those policies, such as treating housing as a human right and making sure that everyone has access to somewhere, warm to sleep, 3 square meals, and a dignified place to call their own.
So I want to transition a little bit around to the political side of this conversation,
Sure.
because, making that jump from being a full-time physician to a politician, obviously because you were trying to make more change, right? Mm-hmm. Taking the next view of the next level, how do you actually make that change, right? You can try through being a policy leader and an advocate and an MPP that can put in private members' bills, but you're not going to be effective unless you're in government. You're not going to be as effective unless you're in government. And so the question around you and your party right now is what's next, right? Bonnie Crombie, who was our mayor here, who was the leader of the Ontario Liberal Party for a couple of years, has stepped down, and we're talking about, again, rebuilding the party. And so you ran for leader last time. I ran for leader the time before that, so we have that in common. And
cool club.
I didn't run to win. I mean, sure, everyone runs to win, but I was very, very interested in pushing certain policy ideas that I wanted the party to move forward with. Universal basic income was one of them. Universal childcare was another, which the federal government has now essentially instituted with $10 a day daycare, and reforming the education system. That was kind of my thing. In your last campaign, when you ran for leader, you talked a lot about healthcare and how all policy is health policy, which you just mentioned now. Where do you see the party needing to go? What do you want to see in sort of this leadership race that we're about to kick off in the Ontario Liberal Party? And, how is that going to lead the party to hopefully being successful and being elected the next government so that they can implement the changes that we're looking for?
It's so interesting. As I stepped away from full-time clinical practice into the political world, I found it very frustrating. When someone comes into the emergency department, you find out pretty quickly whether they're going to get better or they won't, whether they're going to go home or they're going to get admitted to hospital. When someone comes in cardiac arrest and you resuscitate them, you know whether you're successful or not successful pretty quickly. That instantaneous feedback, you very rarely get in the political world. Mm-hmm. And so as we reflect on where the Ontario Liberal Party has come from in the last 7 years, as we face a third leadership race in such a short amount of time, it's very easy to believe that we haven't made any progress or to feel frustrated. And of course, do I wish that we were even further than we are right now? Of course I do. But I can look back on the 7 years of our party and say, well, with every election, we took important steps forward. We got some new MPPs elected in 2022, got party status and 30% of the vote in 2025. We now have a Liberal Caucus Services Bureau that allows us to further amplify our efforts and our impact. And so number one, I think it's so important for us not to lose sight of that, and to think about what are the next ways that we can continue to grow that impact. And so while we face, as we are about to face a third leadership race, I am excited to see the ways in which it will further reinvigorate our party and people across the province. As I talk to my constituents and Ontarians writ large, what I hear is an enormous appetite for a government that actually feels as though it is responsive to their needs, not to the needs of, the Premier's friends or private donors. That is a pretty universal feeling that I've been noting. And so what we have now is an opportunity for a grassroots, enthusiastic, exciting campaign that's not just based in Toronto and Ottawa, but that reaches out, further out of urban centers into rural and remote Ontario, and that's focused on, to some degree, prosecuting the failures of the Ford government. That is necessary. But I think what is equally, if not more necessary, is making sure that Ontarians are dreaming big enough, are demanding enough. It's not good enough just to say that I want healthcare to be better. It's not good enough to be satisfied that if you have a pharmacist in your rural community that does prescribing for minor illness, it's not good enough to say that you have the primary care that you deserve. And so in this upcoming leadership race, what I hope that we see is a grassroots effort to help Ontarians dream big enough, and an Ontario Liberal Party with some spectacular leadership candidates that come forward with bold, progressive, amazing ideas that will galvanize Ontarians in every corner of the province. I think when I reflect on the progress that we made in the last 7 years, it's all been culminating to this moment. And I think something extremely exciting is about to happen.
So is that person you?
It might be. It might be.
You're thinking about it?
I absolutely am thinking about it. I have to think about it. Alvin, I got to tell you, it is pretty crazy. I don't mind admitting this. I've only been elected for 3 years. And the change that I've witnessed in the party in the province in only 3 years has been remarkable. Some in good ways and some in bad ways. It's given me an unparalleled insight into where we need to go and also how this government operates. So I'm very keen to look at how I could apply that towards potentially leading the party. Now, you and I have both run for leadership as well, and we know exactly what it takes to participate in that contest and have a pretty good insight into what it takes to win. Now, unfortunately, regrettably, neither you nor I were successful in our campaigns, but it is really amazing experience. And so as I think about whether I am going to run, there are a couple of factors that have to be in play. Number one, basic stuff like what are the rules going to be? Who are the other people that are running? Because
timeline.
Yeah, exactly. And I must admit, titles are not important to me. What is important is having an impact and somewhere that I can stand up and push forward great policies. And I could do that behind an amazing leader, for example. I could do that potentially by being the leader as well. So, there is that dynamic. But the other thing is, I know the things that I do really well and the opportunities for growth. And I'm always very upfront with everyone around. We all have opportunities for growth. And so I want to see, what's it going to look like? What will the leadership race, how will it play out? And am I ready not just to make promises to the members of the Ontario Liberal Party and the people of Ontario, but am I the best person to deliver that? And I have a lot of confidence in myself, but I just want to make sure. Because for far too long, people have looked at politicians and said, they all say great things, but can they actually deliver? And when I tell people that I'm going to deliver, I want to make damn sure that I can. These are the things that are running through my mind.
So, we don't know the rules yet, and we don't know who's really going to put their name in the hat, so to speak. But we do know that the party's done a lot over the last several years. I've also just been elected in the last 3 years, but a year in politics is a lifetime, and so you learn quickly, especially when you're thrown into the fire. So I would encourage you to continue exploring, and you can count on me as one of the people that would like to see you there.
You're very kind.
It's like I said at the beginning, it's tough to find good people in politics, and you want people to run for the right reasons. And generally speaking, I do think it doesn't really matter what your stripe is. People are trying to do the best thing.
Yeah.
But what motivates them and what gets them to keep going? Like, honestly, I'm not sure what keeps the premier going nowadays, right? He's had a third consecutive majority. You look at the early days in 2018 in terms of how somewhat extreme they were in terms of their actions and sort of where they're landing now, and not really being all that fiscally prudent on a number of things, and yet not focusing on the majority of the government that should be their priority, like healthcare and education, right? So it's an interesting time in politics right now. So I wanted to sort of finish off here by saying, thank you for being a part of it. Thank you for jumping in with both feet and for being one of the good ones that want to get more things done. Let's finish off on a quick personal note.
Okay.
You've represented Don Valley East for the last couple of terms now. What's your favorite part of the riding?
This is way too difficult. This is way too difficult.
Okay, give me a restaurant. I'm visiting for the first time. Where should I go?
All right. Well, I want to bring you into the heart of Flemington Park.
Okay.
In my community, it's in the south part of Don Valley East. It is a community that has a predominantly immigrant and refugee population, and is the most amazing tossed salad of cultures and cuisine and different practices. And so let's come on down to Flemington Park. There's a beautiful plaza right across from where the Ontario Science Centre is. There are some great eats to be found there. Yeah, no. I was very deliberate where the Ontario Science Centre is. I'm not done fighting for that, truthfully. The lights are still on inside. Sure, you can take down the pylon that has a name on it, but the heart and the spirit of the Ontario Science Centre is very much still alive. It's been a landmark. We care very deeply about it.
The subway station is still named Ontario Science Centre.
Actually, they have tried to they have changed the sign to Don Valley, at a cost of millions of dollars, mind you. But look, the reality is there's no indication that a new science center will be in place at Ontario Place by 2029, as has been promised. And the best place for it to be accessible to everyone across the province is right there at Don Mills and Eglinton, the intersection of two, major public transit lines. It's amazing. Yeah. But to come back to your question, let's come back. Let's have a nice biryani in the heart of Flemington Park. And then, from there, there's so many other things that we can explore.
That sounds amazing. Looking forward to it. Thank you, Adil, for coming on.
Pleasure.
Really appreciate your time.
Absolutely. Yours as well.